name is Jailyn Avila, and with this episode, what we're going to do is introduce the FemInEM Second Shift Change podcast. I'm so excited to be here. I'm so excited to introduce all of you to this amazing work that we're doing in FemInEM. I'm joined with my co-host, Rebecca Hellmann, and our fearless leader, Dara Kass. How are y'all doing?
I am currently afraid of lots of things. I don't know if I'm fearless, but I'm otherwise doing well.
I am hot.
Yes, it's hot.
And otherwise, besides very warm.
It is so hot where I'm at in San Diego. It is high 80s and I'm just with zero humidity. I'm like dying. It's just insufferable.
It is like 100 degrees of humidity where we are. So
I already mentioned I'm in San Diego. I work a bit north in Temecula. I'm an emergency medicine physician. Dara, do you want to tell us a little bit about something interesting about you?
Oh, God. I'm interesting. Let's see. I just started another ER job. I feel like I'm in perpetual starting of emergency medicine jobs lately. I am working at Lincoln Hospital in the Bronx. Which is really funny because I trained at Kings County. And so many of the attendings who trained me actually trained themselves in the 1970s in Lincoln Hospital. And now it's very full circle that I am going back there to work as an attending.
I love that. Rebecca, where are you at?
I am at Cornell, Weill Cornell Medical Center in New York City.
Right on. And where did you do your residency? I actually know all of this, just to be clear, but, for our audience, because I think they care.
No, I am also an emergency medicine physician. I did a residency at St. Barnabas Hospital in the Bronx, so a stone's throw away from where Dara is now. And then I actually went on and did a fellowship at Hackensack in New Jersey in both medical education and in women's reproductive health.
And that is why you're so good at teaching, I imagine. Dara, I think most people will know all about FemInEM, but I was wondering if maybe you could walk us through what FemInEM is, where it came from, and just a brief little hint of future directions, or a full course meal of future directions if you'd like.
Yeah, so I think a lot of people know, and especially if they are getting this podcast because they subscribed in the past, that FemInEM started in 2015, and we started around the idea of making an equitable and more accessible workplace for women in emergency medicine, and started to really kind of unionize a lot of the policies that we needed. And it grew to a crazy thing, right? Where we had a podcast and we had a conference and this crazy website. And then for lots of reasons that we've gone through before, we kind of took a hiatus for a while. And then last year, we started doing a lot of work, a lot of us in this space, on reproductive health care and emergency medicine after the rules kind of changed. And in emergency departments, we started seeing more patients, not new patients with reproductive health care emergencies, but the opportunity to treat them, and certainly the laws around that had felt like they had changed. So we relaunched FemInEM as a nonprofit to fill a space around access to reproductive health care in emergency medicine, while also continuing to address the issues for women in our departments. And so that's where we are now. There's a lot going on. I'm sure that over the course of the time we do this podcast, we'll talk a lot about the issues facing women in our field, and also the care of patients who come to see us who need care because of both their gender and their ability to get pregnant.
All super important stuff. I think that there's just a lot of not trusting the appropriate people, a lot of misinformation, and a lot of lack of really just people knowing what is really going on and how it actually affects people, and thinking it past the talking points that some people focus on, devoid of any actual personal experience or diligent review of what the data actually shows, and individuals' kind of lived experiences. And I will say that this experience, being involved with FemInEM, has been such an amazing education. You personally, Dara, have taught me a lot. Rebecca, you've taught me an insane amount of stuff as well. But it's been so nice to be able to collaborate with such an amazing group of people. And we have so much stuff that we are doing and will do. And it's so important. And thank you for building back up FemInEM. I mean, I don't know if it's safe to say that it like went away, but it definitely is having a bit of a resurgence now, which I'm happy about.
Yeah, I mean, look, we stopped working on it. Like for lots of reasons, it hibernated, I like to say. And now it's something we're doing basically every day. I mean, the two of you are working your tushies off. You really are doing so much work on creating content and ensuring that people understand the evidence that's out there to care for patients in our ERs. So it's been a remarkable journey so far again.
Totally agree. Rebecca, you and I, we are both we do education within FemInEM, and you actually came up brilliantly with the title of our podcast and worked heavily on our tagline. Do you want to walk us through that?
Sure. So, second shift change is sort of a combination of two concepts. We wanted to make it very clear that this was a podcast about medicine and about women in medicine and keeping it sort of on brand. So, the shift change idea was both the medical focus of a shift change, right, which a lot of people in emergency medicine are very familiar with, and also the idea that we're really trying to change what we're doing in emergency medicine and how we're approaching women in medicine. So it was sort of a play on that idea of changing that perspective. And second shift is really giving credit to the work that women tend to do once their professional job is done. When they get to clock out at the hospital, they then start their second shift, which is a sort of common term that's used to describe the just sort of the cognitive load that women carry of the primarily doing the household duties and the child care and sort of managing the household and really understanding that when we're putting all of that together, we're really trying to create a shift in that perspective, that second shift, that how we're treating women, how we're approaching female patients, how we're approaching pregnant patients, how we're approaching reproductive health care, and also the people giving that care, including women in medicine, really needs to change.
Yeah, I totally love that. And I really appreciated your insight on that as well. You all have been, both you and Dara have been lecturing extensively, essentially your entire careers, on women's health and equity in medicine and even outside of medicine. And we're so happy to share it with everyone else. Now, this is our format, right? We're going to have seasons because, it takes time to edit and we really want to make sure that we have good guests. We want to make sure that we're talking about topics that are important for the time where we're publishing those podcasts. We're going to aim for around 10-ish episodes in our first season. We are going to talk about reproductive health care and how we're trying to target specific states, specific communities. One of the first episodes is going to be speaking about some of our physicians that are working very diligently in Texas. We are going to discuss well-being and workplace strategies. We're going to do some knowledge-based podcast where we're going to talk about how to administer mifepristone, because that's something that not a lot of EM physicians know about, that's something that can be done. We're going to talk about how to lead as a junior woman in emergency medicine, institutional change-making, parenthood, intersectionality. We're going to do some wrap-ups, and we might even have some bonus episodes. So we have a lot in store, and we're so excited to share it with you all. Now, even though we have all of our episodes planned out, I wanted to make sure to let you guys know, the audience, that you can get involved as well. And this can be in front of the camera, let's say, on the front lines. It can be behind the scenes. And it's as simple as going to our website, that's feminem.org, and putting in your contact information there, and we'll be able to plug you into whatever thing you are able to and interested in helping with. Dara, do you have any specific roles that we're looking for help in?
So I mean, for the most part now, right, we're looking for people to help disseminate the content, right? So we do a lot. You guys spent an incredible amount of time developing these digital learning modules around things like miscarriage management and ectopic pregnancy and methotrexate and mifepristone. And so right now we want to really, as fast as possible, get our entire community of emergency physicians on the same page. which really has to do with, regardless of the state you live in, you should at least be knowledgeable about the standard of care. Just because you can't necessarily practice something in your state because of changing laws, it doesn't mean you can't know about it. So I think the first call to action for anybody who's listening is to go on to the FemInEM website under resources, or even just straight to courses.feminem.org and take a couple of the CME classes. It's like you don't have to get CME if you don't want to. And it's really just for your knowledge. But it really will help us ensure that our entire community is up to date on things like, how do you dispense mifepristone, or what are the indications for giving this medication? And especially as we see the politicization of the information that people need to prescribe this medication, we want to make sure that that is not happening within our community, and that people know how to take care of patients. At least they have the knowledge, even if they're not empowered to practice it all the time.
I think that that's a really important point. I think that that's a lot of what we're emphasizing here, is just making sure that everybody, physicians, APPs, that residents, learners, anybody is really up to date on standard of care and evidence-based practice, because there is a lot of misinformation out there. And so we're really working hard to try to, this as well as I do, Jailyn, that we're working really hard to make sure that our that our information is really evidence-based, and that it can support the practice of physicians anywhere. And that it's ensuring that patients are getting standard of care every single time they're coming into the emergency department.
Yeah, totally. And actually, it's kind of interesting because we worked so hard on our courses, and I didn't plug it. And I definitely want to advocate for that. Courses.feminem.org. It's an LMS with lectures, assessment questions. And as Dara mentioned, you can get CME or not. And it's there to help bridge that
free.
knowledge gap. And it's free. Thank you. And it's free. And I happen to think that they're pretty good. I think Rebecca did the vast majority of V1, because we're going to naturally be adding a bunch of stuff to it. And she did a phenomenal job.
I agree. And I think that's, if you go to even just going to the website and perusing what's there and seeing all the different resources and how many things we link to. And I think the other thing as a call to action is, if you're interested in doing stuff, whether it's understanding more about content, giving a lecture, being empowered to make change, like reach out either through the website, or you can reach out to any of us through socials, or through, I'm sure our emails are not hard to get. Just to say, I'm really interested in doing this work in my home state. I'm from Missouri, or I'm from Idaho, or I'm from California. This isn't all about restrictions. Sometimes this is about expansion. And so it would be great. Or I'm the head of my Women in Medicine group, and I'd like some resources. Like, there's a lot we can do together. It's harder now, actually, than when we first launched, because social media sucks, right? So the deterioration of Twitter it's a really big deal to the work we do, because the last time we just put things out on Twitter, we had such a strong med Twitter environment, and everything was so tight that we could just put articles up, and it would just pop into your Twitter feed, and we're all on Twitter so much. Now we're much more disjointed. And so even though we may be on social media more than we were, 7 years ago, the feeds are so much harder to penetrate. And I am not a TikToker as much as people want me to be. And so I'm not getting out there the same way. And so that means we're going to have to work harder to connect with each other.
I would love to see Dara do TikTok dances,
or the
so
videos.
much, do the videos, whatever's popular. I would love to see you do either the Taylor Swift singing to your animal, or the one where it's a partner says, you're going to listen to my wife or my husband or my boyfriend or girlfriend, and they're going to tell you about something. And then they switch, and then that person very timidly is like, here's my Lego. And then in the background, everybody's like, listen, you should do that.
Are you talking about, I think I saw one of these a friend of mine did, where her son did his Pokemons, and she had a sign behind it that said amazing or something. And I had no idea where that came from, but that was cute when it was a 7-year-old showing his Pokemon cards. Less cute if it's me and my husband and he's showing off his Netflix queue. I don't know what that is. What is he showing off? But I appreciate how much time you spent on TikTok to be able to give me the 2 most viral trends on TikTok right now.
Of which I knew none of. So
I only do this because it's on Facebook or some other antiquated platform that I'm on.
Nope, that is not
well,
for me.
We'll work on that. That'll be one of our projects moving forward, Dara.
You can make me young if you want, but I am definitely getting older by the day.
And you know what? Maybe we'll come up with our own little
We'll do
TikTok challenge, or
we'll do our
FemInEM challenge.
own, yeah, our own viral trends. We'll do it. We'll be
Yeah.
the change
And if
makers that we need to be.
somebody has an idea, we'd love to hear it. I mean, that also goes to content too, right? If there's certain people that you guys would love to hear or ideas that you want us to cover either on the podcast or making lectures, there's a ton of ideas that are in the queue that we're creating more and more online lectures for to sort of expand our LMS portfolio. So please, 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 please be in touch if there's something that you feel like would really enhance your clinical practice or your knowledge base. We are open to exploring lots of different subjects.
Perfect. And I agree. So this is a short episode. It's not really hugely knowledge based in reproductive healthcare and advocacy. It's more of a, hey, this is what we're doing now, and we're so excited to share it with you all. This is the Second Shift Change podcast. I'm Jailyn Avila, and we have Dara Kass and Rebecca Hellmann. We're going to have a plethora, a potpourri of guests, and we're looking forward to hearing from you all.
See you soon.